This is QD Clinic. QD Clinic is brought to you by RoomNow.live. March 19th and 20th, a day and a half of exciting, earth-shattering, game-changing education by your peers. You should be there. Today's case is about another way to discuss COVID. This happened to me last week. Patient comes in to see me, polyarthritis, swollen joints, abnormal labs, blah, blah, blah. We're all wearing masks, having distancing. I always ask patients early on in the history, have you had COVID? No. Have you had the vaccine? No. Pause, look over. Would you like to discuss that? No. Emphatic no. Big eyes, big eye roll, like how dare me even ask. Again, long pause. I'm sort of like 10 minutes into the history. I've already asked a lot of pithy questions. She's a little irritated with me. Like, maybe she doesn't like my attitude because I'm kind of grilling her like she's on the witness stand and treating her like a hostile witness. I'm really not. I'm just trying to get information out of her in a time-efficient manner. But this is not going well. And then I bring up COVID, and it's really not going well. And I pause and I say, could I give you one statistic? She said no. Okay, we move on. What's the one statistic I would have given her? I would have given her the statistics that in 2020, 2021, the frequency of influenza was down 95% everywhere. Dallas County, state of Texas, United States. And why? Because of the mask. And oh, by the way, the vaccine's probably 5 to 10 times more effective than the mask. That would have been my one chance, you know? But an interesting thing happened. And that was, I spent the next half hour going over her, doing a good exam, talking to her about the right knee worse than the left knee. What can we do about it? Giving her lots of options, coming to a plan, showing her I cared, basically building trust. And as I'm writing down my notes for what we're going to do to start therapy on this woman and inject that right knee and whatnot, she blurts out, well, I didn't get the vaccine because my daughter hasn't had it yet. And again, not a good reason. And I started to tell her that we could discuss that if she wants. But I want to get back to, we did her first. And then I said, do you want me to tell you about your daughter is getting the vaccine and you getting the vaccine? And she said, okay, what do you have to say? And after talking to me, she said, well, I would like to get it. I plan to get it, but I'm worried about her. And I'm thinking maybe she should get vaccinated first. So what happened after that's not important. What happened is that we created the opportunity to have the discussion. This reminds me of Dr. David Karp, my chief at UT Southwestern and recent past president of the American College of Rheumatology. His presidential address at ACR 2021, the Convergence meeting, was called Rheumatology is Amazing. You can read it right now online in A&R. It's a nice read. It's about, how we and he and the ACR got through the pandemic and what we're doing to move forward. He references Dr. Kimberly Manning and how she advised the ACR and us rheumatologists on how to have the discussion with patients, especially patients of color who may have a real bias about that. And in the paper is the citation that says, number 1, ask first. 2, listen completely. 3, think about who the person is outside of being a patient. No question is stupid. Address without judgment. Keep the dialogue going by probing. What do you think? How are you? What's your feelings on that? Do you discuss this with your husband? That sort of thing. And acknowledge the slow yes that can occur when you build trust in a relationship and an environment where they're not going to be threatened. I don't know if this happened to you, but it's happened to me where I want to discuss COVID, protecting them from COVID and getting vaccinated, and the patient is immediately adverse to it. And one of the reasons, uncommonly, is they've been belittled and berated by their family doctor. I mean, some so severe that the family doctor fired the patient and called them stupid as they fired them for not taking the almighty doctor's advice. Obviously, that's a level of diplomacy that I hope we never achieve as colleagues. But, it's certainly a good way to turn off patients from the utility of your sage advice. So being helpful starts with being trustworthy, I guess is what we're saying. So I found it interesting that the beginning of the visit started with, no, I don't want to hear from you about nothing. Just address my problems of my joints, and I'm done with you. And at the end, she's asking me, what do I think? Do I really think it would be safe? These conversations can happen. They take a little time. I like Dr. Manning's acknowledge the slow yes. Sometimes it takes a while to get to yes. Be there. Be helpful. Tune in tomorrow.